let's start general anatomy from today. Now on, I will be uploading videos on general anatomy. This is the part 1 of general anatomy. Now let's start. The topics include concept, regional and systemic anatomy, regions of upper limb and lower limb, normal anatomical position, supine, prone, fundamental and lithotomy position, and anatomical planes. Let's start it with anatomy. Anatomy is the science that deals with the structures of the body from macroscopic to the microscopic level. The subdivisions of anatomy includes gross anatomy / topographical anatomy, microscopic anatomy, that is histology, surface anatomy, comparative anatomy, physical anthropology, living anatomy, clinical anatomy, radiological anatomy, developmental anatomy / embryology, genetics, and experimental anatomy. The regional anatomy. In this approach, all the structures in a particular region of the body are studied at the same time. Conventionally, the body is divided into 6 regions, that is the head and neck, brain, thorax, abdomen, upper limb, and lower limb. These are the various regions of the body, that is the brain, the head and neck, thorax, abdomen, upper limb, and lower limb. Now, the systemic anatomy includes all the systems of the body. That is, in this approach, all the structures forming a particular systems are studied together at the same time. The various systems of the human body includes integumentary system, that is study of skin and its appendages, skeletal system, that is study of bones, articular / arthropology / syndesmology, that is study of joints, muscular system, that is study of muscles, nervous system, that is study of neural tissues, cardiovascular system, that is deals with the heart and associated blood vessels, lymphatic system, that is study of lymphoid tissues and lymph vessels, endocrine system, it is the study of ductless glands, digestive system, it is the study of structures concerned with the digestion, respiratory system, it is the study of structures concerned with respiration. Next, these are the systems, that is integumentary system, that is the skins, skeletal / articular system, muscular systems, nervous systems, cardiovascular systems, that is the hearts and its along with blood vessels, and this is the lymphatic systems, all the lymph nodes and other lymphatic vessels are shown here. Next, the different positions of the body, that is anatomical position. An anatomical position is the reference position of the body. In this position, a person is concerned to be standing erect with eyes looking forward at horizon, the upper limbs hanging by the side of the body with palms facing forwards, the upper limbs positioned straight with feet approximated to together and flat on the floor and toes pointing up forwards. The figure 2.1 explains about the anatomical position. This is the figure 2.1 and this is the proper anatomical position. And this is the fundamental position. In this, it is the same as anatomical position except that the palms of the hand face the sides of the body. That is the figure 2.2 explains about the fundamental position. In this position, the position is often used in discussing the rotation of the upper limbs such as pronation and supination. Let's see about the fundamental position. This is the fundamental position where the hands are just not like this, it is like this, that is whatever that it was not in supination, it is in that is lateral position. Not palms are not facing towards the that is towards the forward position, it is just in lateral position. Now the fundamental position, it is not a fundamental position. The other positions of the body, that is spine position, that is recumbent position, the position the person lies on the back with his or her face directed upwards. Prone position, the person lies on his or her belly, that is abdomen, with his or her face directed downwards. This is the supine position, proper sleep position. This is the prone position when we sleep along the backside, backward direction, and this is the lithotomy position, and this is the position of during delivery of the baby. This labor pain position. Then lithotomy position. The position lies supine with the buttocks at the edge of the table. The hips and knees are semi-flexed and the thighs are abducted. This position is used for having adequate exposure to the perineum. Anatomical planes of the body. Now we study about the anatomical planes of the body. It includes mid-sagittal plane, then sagittal plane or parasagittal plane, coronal plane, and transverse plane. That is mid-sagittal plane. It passes longitudinally through the sagittal suture, that is midline, and divides the body into equal rights and left halves. That is sagittal or parasagittal plane. Any longitudinal plane which passes parallel to the mid-sagittal plane is termed as sagittal/parasagittal plane. It divides the body into unequal right and left halves. Coronal or frontal plane. It passes longitudinally at the right angles to the median plane and divides the body into anterior and posterior positions. Now, the transverse plane, that is horizontal or cross-sectional planes, it passes parallel to the horizon ground at the right angle to the long axis of the body, dividing the body at any level into superior, upper, and inferior, lower positions. It is perpendicular to the median plane. The anatomical terms, that is in the next part we will be studying about the anatomical terms and rest topics. Let's conclude the video and that. Hope you like this. Like and subscribe and follow the content and comment if you like it.